Hey, you wouldn't do anything to harm yourself, would you? Your body wouldn't do anything to harm you, would it? Let's talk about something called innate intelligence. This is your inborn wisdom, something you're born with. And this is the intelligence that runs yourself every second of the day. So you wake up in the morning, your heart's beating, your lungs breathing, you're digesting food, like literally a trillion things are happening or more every single second, and you don't have to think about almost any of those things. That's your inborn wisdom, which is communicated over your nervous system. So I want you to understand a lot of times that we've been taught in our society by the pharmaceutical industry, by the medical regime, or our beliefs are that symptoms and issues and sometimes diseases are actually a sign of healing that we're treating as a symptom or disease. Now, I want to use cholesterol as an example. You can kind of use anything in here. And that doesn't mean that there shouldn't be medical interventions, sometimes certain things that we should do, but we want to be really cautious of interfering with that innate intelligence versus letting it do its work. So let's use the example of cholesterol. Number one, did you know that 80% of cholesterol in your body is made by your liver and your intestines? Only about 20% is which we take in dietary. So when we're told that you've got high cholesterol, you've got a cholesterol issue, why would your body make too much cholesterol? And who decided that it was too much? So the pharmaceutical companies make a lot of money out of prescribing pharmaceutical drugs that lower your cholesterol. But again, we got to go back to that question, the intelligence of what is high cholesterol? Why would your body have too much cholesterol? And what is normal, right? So I want to tell you some of the research that's actually come out. It'll be shocking to you. This is just a few things that I found. Number one, this is out of University of San Diego. They said there's been no study, this is pretty surprising to me, no study has shown that cholesterol-lowering drugs lower overall mortality in women. Now, I'm assuming the reason you're taking a cholesterol drug, if you are, is because you don't want to have a heart attack or die. Well, this is saying there's never been a study showing that women taking cholesterol drugs benefit from that. That they might lower their cholesterol, but it doesn't decrease your risk of dying, which is the whole reason you're taking it. Plus, there's side effects to these medications, as you know. University of San Diego, same one out of the same school, University of San Diego School of Medicine, that high cholesterol, so somebody had high cholesterol over the age of 75 years of age, is actually protective, it's actually beneficial to have high cholesterol over the age of 75. And we'll come back to the age here in just a second. Another study, European Heart Journal, the 3-year study involving 11,500 patients, they found that the low cholesterol group was more than twice as likely, 2.7 times higher, in a relative risk of death relative to the high cholesterol group. So again, the high cholesterol group was less likely to die, and the most common cause of death in the low cholesterol group was cancer, while the risk of cardiac death was the same in both groups. So again, the side effects of the medications, with this, you can kind of read between the lines and say, hey, is these cholesterol drugs increasing the risk of somebody's cancer? In support of these findings, same study, these researchers point out the previous studies found a higher increase in lung cancer when total cholesterol levels were maintained below 170 milligrams per deciliter. Huge study, a 30-year follow-up study to the Framingham, I think that was Framingham, Pennsylvania, huge lung study that they did. And they found that, in this in-depth study showed that after the age of 50, there's no increased overall death associated with high cholesterol. So now we go from age 50 and up, there's no benefit or no increased overall risk of death. And there was a connection with a direct association between low levels and dropping levels of cholesterol and increased risk of death. So I could go on, there's a bunch of studies here. So the point I wanted you to make is to understand, again, not just cholesterol, but when your body's producing sometimes a symptom, let's say neck pain or headaches. If your spine shifts out of alignment, these muscles will tighten up, it can affect the blood flow up to your head, you might produce neck pain or a headache. That symptom is a sign of your body healing, right? If you've ever had food poisoning and you have got diarrhea, you're sweating, you feel horrible, you're maybe vomiting, those are signs of healing. Your body's actually trying to get that stuff out of your system. If you get bit by a spider, you have swelling and pus and inflammation, that's your body healing. You don't want to get rid of that pus and that swelling. You want your body to take action and heal that. A fever is part of the healing process of getting rid of a bacteria or pathogen that's not supposed to be in your body. So I'm not saying to ignore these symptoms. I'm not saying that we never should do something about those things, but I want you to understand that what we do in this office in terms of chiropractic here is we work with innate intelligence. Our goal is not to treat your symptoms. We want you to feel amazing. We have a desire for you to just have an amazing, awesome life and feel great. But if I treat your symptom, I might actually be working against your innate intelligence. But if I simply do an adjustment to remove interference so your brain can talk better to your body and allow this innate intelligence to flow, you're going to have the best chance of healing. And this is oftentimes where we don't ask you how you're feeling. It's not that we don't care. We want you, again, like I said, to feel great. But I want to objectively look at where your body needs to be adjusted, remove the interference, and allow your body to heal. So if you are recommended to take an antibiotic or a cholesterol medication or a blood pressure medication, you need to ask those questions as compared to what? What is normal, number one? There's no such thing as normal. There's only average. And then number two, am I going to be working against my intelligence? Is my body raising my blood pressure so I can get more oxygen to my tissues because I'm not exercising enough? So maybe the solution is I need to exercise rather than take a blood pressure medication. Again, you got to make the best decision for you, but those are some questions you need to start to think about if you want to have a long, healthy life. First of all, get adjusted, get that innate intelligence to flow to every cell, tissue, and organ of your body. That's going to give you the best chance to heal. And that, in my opinion, is truly true healthcare.